So the basic idea of the study is just that there's mathematical models have been widely used in this pandemic, as you know. Some people have joked that this was like the evil genie wish to a mathematician to make math more relevant. But we used a framework that's pretty widely used. It's kind of called a susceptible, infected, recovered type framework. And so basically you just chop up the population. And so we've done work on that with this kind of model in other settings before. And so basically you say, some of the population is susceptible to disease, some is infected, and as you recover, you gain immunity. And some fraction of the population will be asymptomatic, some will ultimately, be hospitalized and die. But that's the basic setup. And so then we just took that setup and divided into and said, okay, the general population is going to be divided into people who habitually wear masks and those who habitually don't wear masks. And so we'll say a certain fraction does or does not wear masks, and then the masks have so much effectiveness in decreasing incidence of transmission when there was a potentially infectious contact rate. So sorry, this was maybe a little bit wordy, but just basically the idea is that the population, if you come into contact with people who are infected, whether they know it or not, you have a certain probability of getting infected. If you're wearing a mask, that reduces it by a certain fraction. If they're wearing a mask, it reduces it by a certain fraction. If you're both wearing a mask, this kind of multiplies together to reduce that. And so whatever that effectiveness of the masks is, we just can prescribe that in the model. And we can prescribe what fraction of the overall population is wearing the mask. So then we just explore how these two parameters basically interact, effectiveness and coverage level. Our findings are that basically the greater the fraction of people that wear masks, the more effective they are in reducing the total deaths and the peak death rate as well. And this, obviously, the more effective the mask, the more, the greater the benefit as well. But at the population level, even relatively ineffective masks, if they're worn by a sufficiently large fraction of the population, can have non-trivial benefits. And this is actually especially true when the underlying contact rate is relatively low. So in other words, it works best when social distancing, things like this, have been implemented and are being observed. And so when you already have people social distancing and doing things that are reducing this contact rate, if you add this in, it has a fairly large effect compared to if people aren't doing these other things. So it actually has kind of a multiplier effect with these other measures to help, bend this curve down, if you will. They both had kind of similar times of onset of the epidemic, and New York has much higher cases, obviously, and Washington had fairly low, relatively low death in cases. And so we were just exploring the model with those two to say, okay, here's a high transmission scenario, here's a low transmission scenario. What does the model suggest in these two different scenarios? And now we're looking a little more at Arizona specifically after this, but that's not part of the paper that's up right now. Yes, as near universal as possible. I mean, anytime you're because you don't know if you are asymptomatically infected, and you don't know if other people are as well, and so you're protecting yourself and you're protecting others. And the more people do it, the bigger the benefit is for the overall community. It's everyone has to do it for the biggest benefit. It would help. Now, there's a lot of uncertainty as to exactly how effective different homemade masks or fabric masks are going to be. But assume even if they're only say kind of 20% effective at the low end of what is reasonable to assume, if most of the population is wearing them, this can still actually have a very large effect on the total number of cases, total number of deaths. And so even relatively ineffective fabric masks have the potential to be effective at controlling the disease at the population level if enough people are wearing them. Obviously better quality control is always going to be better if you have a standardized product that has quality control. On the other hand, is that a feasible near-term option? We're already with surgical masks, N95s already should be prioritized for healthcare workers. So in an ideal case, yes, in an ideal case, yeah, we would have this standardized production of ramping up and just universal distribution and use. But if that's not a logistically plausible thing, the second best is anything better than nothing, but try to make it as high quality as possible. High quality cotton. Make sure you're actually fitting it on your face. You're keeping it as sealed as possible, covering your whole. You have to use these. Use and quality of the mask are both going to determine how ultimately effective it is. In a perfect world, if everyone could have an N95, yes, that would kind of be my short answer. Surgical masks for most of the general population would also be sufficient, most likely, especially because surgical masks protect, again, if they're used properly, can protect pretty well against droplet transmission, which there's there's still lots of uncertainty in exactly the modes of transmission for COVID-19. But droplet transmission and also infected contact, infected surfaces, things like this are probably the dominant modes. There could also be aerosolizing as well, but especially if you're not a healthcare worker where you're surrounded by aerosolized, potentially virus, a surgical mask is also going to be most likely quite effective. That's kind of the idea is let's say you were infectious, just simple numbers. If you were infectious for 5 days and you contacted people, one infectious contact per day, you're going to create 5 new infections, right? And then those 5 new infections would create 5 new infections. And so you get exponential growth of the epidemic. And so by reducing that contact rate, if you reduce it to 1, it's like you only replace yourself and you're right on this border. If you reduce it to less than 1, or, then the epidemic goes away. And so with flattening the curve or epidemic being controlled, you're getting around that threshold. And so smaller changes in the effective contact rate can have a bigger relative effect when you're near that threshold. So things like masks or other measures as well. Mm-hmm. You have a kind of bigger relative effect at the margin there when you're getting there. So that's this idea that masks could synergize with other social distancing, other public health measures when you are getting to the point where you're starting to control the epidemic, because it helps you push you over a threshold to be more fully controlling the epidemic.
Cool.
I would just say that the study, again, there's uncertainty as to how much any individual mask or any of these different things will truly help, but overall, they probably do help a little bit. And the thing is that the bigger the proportion of the bigger the proportion of the population that is engaging in these measures, social distancing measures in general, but also masks as well, the bigger the benefit there is for everyone in the community. And so this is true whether you are sick or whether you're healthy. It helps protect others, it helps protect you. And so the more people who do it, the bigger the benefit there is for everyone, whether you're sick or healthy. So that's kind of the takeaway, I think.